morning, good afternoon, good evening, depending on what time you're watching this podcast. This podcast series we call Race, Culture, and the Church. Race, Culture, and the Church. And as I like to introduce each podcast the same way, so in case you just pop in at any random point in this arc, this trajectory, you know that it started 1 week after the murder of George Floyd. And so we have over 50 interviews in the bank, if you will. And I invite you to subscribe to Race, Culture, and Church. But I am so pleased. I'm honored to have Dr. Flo Cofer, Doctor of Epidemiology and mayoral candidate. Welcome, Doctor.
Thank you for having me, Pastor Meeks. I really appreciate it.
Oh, it's our honor. I know this is a very busy time for you right now, to say the least. Not only do you have a vocation, you have a job, but you also are doing other things like running for mayor. Well, we'll get to that in a minute. But really what I want to do is just spend a minute to just try and dive in and to get to know the doctor. You're the child of two. Your father was a middle school math teacher.
Yes.
Your mother was a middle school English teacher.
Yes.
You probably didn't get any slack when it came to doing your homework or
None at all. My
No.
parents took education very seriously, but they were also really fun people. So they thought about education in all aspects of our lives. So we would go on vacations and drive, throughout the country and stop at historical landmarks and have conversations about what we were seeing and what we were learning and, how the freeway system was set up and numbered. And I would notice things and they would talk to me. So they really made learning a lot of fun,
Wow.
like a quest for knowledge always and all things. And I really appreciate that my parents would say, if I asked them a question, I don't know that. Let's look it up together. And so we would look it up in the encyclopedia or go to our local library. And so they made it fun. My mom still reads to me and I am 40 years old.
Wow.
And I love
So
that.
you call mom up on the phone. It's like, okay, mom, I'm ready for a good bedtime story.
Usually she does it when we're in person together, but like whether it's an article or a book, my mom, I remember, it sort of started when I was young and she read to me and then we just never stopped the process. So when I was in middle school, she read Lord of the Flies to me because it was one of my books for school. There was always a book we were reading. She's read most of the Harry Potter series to me. She just in fits and spurts. So not the entire thing, but she'll, pick a chapter or, hey, listen to this. And then she'll read an article that she's reading. It's become our thing. So
Wow.
she's always reading to me.
That's wonderfully interesting. I'm too old for the Harry Potter series, but Lord of the Flies was required reading.
Yes.
I can imagine mom sitting down and reading Lord of the Flies to me though, but that's very
and all the
interesting.
voices, right?
Oh,
Piggy had a voice, and this and then exploring the beast motif, and it was just
Oh,
wonderful.
wow,
And so
wow.
I always enjoyed it. She read in high school. There are books I remember more than others, but I definitely remember her reading The Scarlet Letter to me, in the voice of Hester Prynne, and just like the way that she
Wow.
would tell these stories, and it made it fun. It always made reading and learning so much more because it was a bonding activity, and she, just never stopped. So I have
Wow.
always loved that.
Well, that's a blessing. You still have your mom
Yes.
that is living, but
Yes.
I understand your father passed away when you were 11.
Yes, a month before my 12th birthday, my dad passed away from congestive heart failure. And, I look back on that. I think there are layers to experiences we have in the way in which they can be inflection points for us. And for me, that certainly was one. There's actually a new layer to it that I discovered more recently. But, in my teens and 20s, I got into public health because I began to see patterns. I understood that there were preventable causes of early death, and that I wanted to be a part of addressing those and preventing those
Mhm.
so that other people would have the time that they deserved with their kids and their families, because my dad and I didn't get that. And so I think about the fact that, he started smoking before the tobacco companies were honest about the harms that did. Tobacco used to be lauded as this cool thing to do. All the
Correct.
cool kids are doing it
Correct.
and there's no harm, right?
Right.
And so my dad started smoking, when there were predatory, advertising in communities like his, and when he wasn't being told the truth about it in the way that your subsequent generations have been. And so the smoking rates have plummeted. And so that was one of his risk factors. He also worked in the steel mills with his father before he went to college to become a teacher. And so we know about the environmental exposures in workplaces like that. And then he also, was exposed to asbestos, in some of the buildings that he worked in his early career. And so I think about the way that all of those contributed to his shortened life expectancy. But then I also understand the way that my life was benefited from some of the policies that protected me. My mom was able to retain, our house on a public school salary, and I was able to get individual and group grief counseling at my public school. My friends were given an excused absence to attend my dad's funeral to be able to support me. And so all of those were policy decisions that protected me in one of the hardest times of my life, where I could have not only lost my dad, but lost my community if we'd lost our housing. I could have had no social support. I could have not had the mental and grief support that I needed, to process losing a parent. And so that was really important. But then there's another layer to it, I think, that came up more recently for me. And it was while watching a city council meeting, and there was a 10-year-old girl. The police had shown up to her house, and she was temporarily, restrained. She was put in handcuffs until they realized how old she was and that this was inappropriate. And I thought back, and the first thing I thought about when I was, seeing that was the only thing that could have made the night that my dad died worse is if, when I was the one who called 911, while we were out with my family for my aunt's birthday dinner, and I called 911. And the only thing that could have made that night worse is if, instead of an EMT at the table over from us at dinner and, a paramedic showing up, if somebody had shown up with, handcuffs and started arresting my family, or not treating my father, and I would have had regrets. Like, could he have lived had there been a different response? And it would have made that night even more traumatic. And so I also think about, the nature of the experiences that we have and how our response to them, our institutional response, can make things better or worse. And I really fully, feel like my dad got the best of possible care. There was literally a paramedic at the next table over who immediately started rendering aid. And while I ran and called 911, and then the actual, ambulance arrived and they started. And so I walk away with, like, that was my dad's time to go. There was nothing that could have been done to be able to, in that moment, to be able to address it, because he got the best of care. But how would I feel if that wasn't the case?
Right. So was that here locally?
That was not. That was in Pittsburgh, where I'm from.
Pittsburgh, Pennsylvania.
Yes.
Okay. So what drew you to Sacramento?
The weather. Truly, I came here about 20 years ago for a fellowship at the Department of Public Health. And when I got here...
So you were attending college at the time?
Yes, I was in graduate school at University of Michigan, and I got an email on the email listserv that said, hey, there's this California Epidemiologic Investigation Service fellowship. I was finishing up my master's in public health. I hadn't started my doctorate yet. And so I was like, oh, this sounds great. I'd love to go and do the work that they were describing. I think I had been to Sacramento once before when so we have some family friends that lived in Benicia, and my dad helped drive them out, back in like 1989. And I think we probably went on a trip to the state capitol and something else, but I had not spent any time here. And so when I got the fellowship, interviewed for it on the phone, all of that. And then when I got it, I was like, great, I'm moving to Sacramento. And then my first day of work, I walked down Capitol Avenue at lunchtime and saw those palm trees. And I was like, girl could get used to this. I was like, I don't have to scrape snow. I was here for the year. And I was like, I think I'm going to stay. And so fast forward, almost 20 years later, here we are.
That's amazing. So this was during your time at when you were still in your graduate program.
Yes.
You ultimately pursued your doctorate in epidemiology. And I think you shared at one point that your father's passing was the reason for pursuing that course, that
Absolutely.
educational course. Unpack that a little more.
Yeah. My mom and dad were always involved in lots of things. So it's important for me to say that my dad coached girls basketball, and eighth grade or middle school girls basketball, and with his best friend as the rival coach. So they were always going up against each other. My mom was always, involved in everything. And so when I was in college, I was helping my mom review scholarship applications. And these were mostly Black and Latino students who were applying for, a scholarship to go to college. And what I noticed was, and probably my awareness was heightened because I had had this experience, the number of students who talked about losing a parent as part of their essay before they were graduating from high school.
Hmm.
And of course, I had that experience in middle school. And it was the first time that I started thinking about this, not just about me, right? Because I just thought that was my experience. And then started seeing the pattern of wow. And so I looked up life expectancy. And I was like, oh my gosh, the life expectancy is different by race and ethnicity, with Black men living the shortest amount of time in the United States of any demographic. And that was the first time that I realized, like, this was not just my experience. This is an experience that's shared by lots of other people, and that there are causes to it. And that was really the beginning of my introduction to public health. I still didn't have, the name for it yet, but I was like, there are patterns that need to be disrupted. And then thankfully I had a wonderful professor in college, Dr. Demanja, who I was doing, some chemistry research. That was my major. And I kept asking him, we were analyzing breast milk using gas chromatography. And I kept asking him what I now understand are very public health questions. What impact do these IR bans have on the ability of, the women we got the samples from to be able to lactate, and what's the impact on the baby, and is there a growth pattern associated with it? And he was a bench chemist. So I think eventually I joke with him about this all the time, that he got tired of me asking him questions that he didn't care about. He just wanted to analyze his samples and move on. And so he said, do you have room in your schedule next term? And I said, yeah, I think so. And he said, there's a class at Clark Atlanta University across the street from Spelman that I want you to take. And it was a maternal and child health epidemiology class. And as soon as I got the syllabus, I was like, these are my people. Like, I have been majoring in women's studies and chemistry and minoring in math, trying to figure out how to put all these things I was interested in together. And here we have it. It's epidemiology, and especially maternal and child health. Like, all these things come together.
It sounds like I'm engineer by vocation, but it
Mhm.
sounds like you've approached this systematically, that there's a
Yes.
systems approach to what you do.
Yeah, because what we understand is that systems are perfectly designed to get the outcomes that they do. And so what we see is a feature, not a flaw of the design. And so if we want to have different outcomes, we have to redesign how we do things. We have to redesign our communities. The patterns can be disrupted. There's nothing about, let's take Black men, for example, that should mean that, like, inherently about them from their birth, that should mean that they live, 10 years less or 13 years less than, the demographic that lives the longest, which is right now white women. There's no reason why that should take place other than the environmental factors. And I don't just mean air, water, et cetera,
Correct.
although that too, but all of the things we interface with throughout our lives, the stressors, the financial stressors, the ways that racism infuses itself into our institutions, the disproportionate impact that has on our communities and on our ability to be able to live, the number of years in our life, and the amount of life in our years. And so that, I think about it from a systems perspective of, you can't just pull on one lever. You have to really think about, how are we doing things? What is the overall experience that people are having if we're going to understand patterns? And epidemiology gave me the tools to be able to both look at individuals and see what's happening with you sitting in front of me, and also then take the 50,000 foot view and be able to see what are the patterns we're seeing and how can we disrupt those, while also giving an individualized, a medicine approach to an individual about what's happening in their particular life.
So you work now at Public Health Advocates.
Yes.
What is that, and what is it public health advocates do?
Yes, Public Health Advocates is a 24-year-old nonprofit organization that works statewide in California, really focusing on the places that we live. And so we look at policies that we can pass, we look at strategies we can employ to be able to allow people to live longer and to live better. And so some of the things that we've done over in the past, we really started in nutrition and physical activity. And so if you've ever gone to a restaurant and seen the calories on the menu, that was one of our big bills back in 2008. And it's become a federal model for the federal legislation that also included menu labeling. But many of those are the types of things that we started with, getting junk food and soda out of schools, and really trying to change the environment, right? Not demonize people for what but understand the environmental impact of, if it's available here and served here, more people will consume it. And so we want to make more things available that are health promoting and nutrient dense. And so that's where we started as an organization. But then we really began to see that beyond just that one way that all these systems were interacting and food being really important to our health, we also needed to think about trauma, and we needed to think about emergency response, and we needed to think about responses to, to overall like the emergencies that happen when they're declared states of emergency, not just when we call 911. And so we really expanded to look at childhood trauma through All Children Thrive, and to 911 emergency response through our first response transformation campaign, to responding to COVID and other emergencies that come up like wildfires and floods and atmospheric storms like California COVID Justice. And so we just have some great programs that are working throughout the state, working with our communities and looking at what policy solutions can we provide to be able to address those concerns.
You've been there 6 years.
I have.
And what's next on the horizon for policy or public health advocates?
Yeah, so part of what we're really trying to do is make sure that we can take advantage of the lessons we've learned from COVID, right? We were kind of exposed in that, so much of our public health system had been defunded during the economic downturn and had not been restored in the ensuing years. And so when COVID hit in 2020, we were kind of caught unprepared and under-resourced. And so there are always dollars that flow in when Ebola comes, when Zika comes, when measles come, like whatever happens,
Okay.
some dollars come in, but we need to be able to sustain our public health infrastructure so that we can also have some preparedness, so that when something happens, we're ready to be able to respond. Because there were people who died, there were people who got incredibly sick who didn't have to if we had had greater infrastructure to begin with and didn't have to build it while we were trying to respond. And so that's part of what we focus on.
How would you, Dr. Kisirier has been in this space. How would you from outside Sac County Public Health evaluate our preparedness?
Yeah, I would say that, the county did the best they could with the resources that they had, but there's a lot more we could do if the county had had more than 2 million of the several $100 million that was given for COVID response, until Dr. Kisiri had to, respond on the record at a county supervisors meeting and say, I'm not being given the resources we need for testing and for, to be able to respond to this. I think, statewide, we closed a lot of our public health laboratories because we didn't have a need for them on an ongoing basis, but we didn't have a plan for when we do have a new virus or something that comes up, how will we expand our capacity to be able to address and, to be able to test and get your results back to people quickly. And so those are some of the lessons that we learned that we don't want to go away now that, we have vaccines and we have antivirals to be able to address COVID and it's less lethal. We still don't want to lose that because there will likely be another, novel infectious disease that comes along. There will be more wildfires. There will be atmospheric storms. We have all the effects of climate change that are coming. And so we need to be prepared with where are the masks going to be stockpiled and who's going to distribute them? And how do we make sure that, messages are given out in all the languages that are spoken in California so that we don't have communities waiting a week or two to get the same message that had been given out in English but hadn't been, also provided in the other languages that people speak so that they can understand and be ready. So those are the kinds of lessons I think that we're learning. And I think Sac County is in a great position right now to be able to address some of those through the Community Health Improvement Plan, which Public Health Advocates is actually working on with them. So that's an exciting part of my day work.
I'm being totally facetious, obviously, but sounds like you didn't have anything else to do. And you are a candidate for the mayor of Sacramento.
I am.
Either you really believe in what you do or you're just a glutton for punishment.
Yeah. I don't think I'm a glutton for punishment, although sometimes I do wonder if there is a little bit of, a masochism that's going on. But, a lot of it is, I get, I have to go back to my roots. I get from my parents this sense of belonging. My parents there was always somebody coming by, cutting the grass and fixing this around the house who was a former student who was trying to raise money for their next thing. Or we were going to, Gordon's to buy shoes for school because that's where one of my mom's former students worked. And we always showed up at community meetings. I was there bored out of my mind because I was, 7 or 8 and they were having some conversation about what was happening. But my mom thought it was important for us to show up and be there. And my dad too, and so I get that honest. And so every community I've lived in, I have been like, well, I live here now, and there's a responsibility that we all have in a community to be involved. So I joined the Active Transportation Commission, and then I was appointed by Mayor Steinberg to the Climate Commission. And then when Measure U was up and we pushed, I was part of a community coalition that pushed for an oversight committee. I'm a big believer in, if you're saying we should build this and somebody should, that the least you should do is somebody should get involved. And so I applied and was on it. And so I've been involved in this community and have had a chance to work with at the county level. I was on the Sheriff's Outreach Community Advisory Board. At the city level, serving on those commissions and getting to know our staff and working in the region as well. And so really understanding these systems from multiple perspectives. And I started realizing we have great plans. We have really dedicated people. We have a fantastic and really committed community of people who see the issues and have great alignment on what the issues are and what they'd like to see be different. And then we have plans to do something about them. But for some reason, we haven't been able to do that final step of deciding and implementing. And so I kept saying somebody really should, and I kept giving, these ideas and these recommendations, and we're working with these coalitions. And that last step of decision making, of agendizing and saying, this is what we're going to do, wasn't happening. And so I finally said, I can't stand on the outside and keep saying somebody should, somebody should. And so I want to give the people of Sacramento an option of somebody who has a public health lens and is really going to roll up their sleeves and say, we're going to take action. We're going to have some smart goals around like specific, measurable, attainable, realistic, time bound that you can hold us accountable to and say, we're going to spend this amount of money to get these outcomes, and we either do it or we don't. And we're going to do continuous quality improvement, because that's the world I come from. Is you try something, you see what works and what doesn't, you adjust, and you continue to try to make progress. And I think a city benefits from that.
Well, let's just set aside your very extensive, very robust resume. There were other candidates for mayor.
Yes.
So why Dr. Cofer? Why not just let someone else do it?
Yeah, that's a great question. Well, I was the first one to announce. And if we go back, historically, in March, the Sacramento Bee wrote this article and they were like, we're less than a year out from the mayor's race and we don't know who's even running, right? Mayor Steinberg was unclear whether he was going to run again. Nobody else had actually declared that they were running. So, when I announced my campaign, I was running against myself. And then about a week later, another person joined the race. And then, 3 or 4 weeks later, several other people joined. But I really started it, and that was April 19th. So as of, less than a year from the March primary, we didn't have anybody running for mayor. So I jumped into the race because I thought there was a need for some clear and decisive leadership, and nobody else was there. I have stayed in the race because I think that when compared to my opponents, I am bringing something new. I am not taking, corporate money. So no corporate PAC money, no fossil fuel money, no law enforcement money, no tobacco money. I am running on the values that are shared throughout this community. And I think that distinguishes me from my opponents. I am running on solutions. And as a person who has not overseen our homelessness rate balloon by several 100%, but who has been watching in horror as it's happened and watching as us take no action on it in a way that has been really helpful. I've watched in horror as 87% of Sacramentans say, we want to be able to have a 24-hour line that we can call that's not criminalizing anyone, but to address mental health and homelessness challenges. And I watched that go down, being voted down 6-3 by our current city council and mayor. And so I've been frustrated because, we always say, can you count to 5 to get something passed?
Correct.
Well, we got to be able to count to 5. And, when I look at a vote like that, none of my opponents would have voted yes. So we would have had the exact same outcome if they were mayor. And I think we need to change that. I think we need to be able to spend $7 million, a real drop in the bucket in terms of our budget, to be able to have something that almost 90% of our community wants to see happen and knows needs to happen. And so that's the kind of leadership I'm bringing. And that's why I'm staying in this race and why, I'm doing so much better than anyone expected in the race, because it resonates with people and they see me living out my values and say, that's what I want. And I'm also not just looking for a soft place to land. I have a great job that I love, and I'm looking forward to going back to after a couple of terms as your mayor. And I want to come in and I want to pass the baton off to others. I want to have a functional local government. And I'm not looking to run for assembly or Senate or, the House or governor. I would like to see my city be all that the people here deserve and that we can build something together.
Well, okay, that's the destination.
Yes.
How do we get there?
We get there in a few ways. So I like to talk about my first 100 days because I think, since that became a thing, long before I was born with a past president who was kind of like, hey, 100 days, here's what I'm going to do. It's something that we often talk about. And so in the first 100 days, I really have two goals. And those two goals are, number one, to have priority setting with the council. We sit down and finally set some priorities around what we're going to do because our staff have described their work as chaotic and constantly being in crisis mode. And that's not the way a functional organization runs. There are crises, but every day should not be playing whack-a-mole with whatever is popping up. There should be a plan in place and some goals that we've set that we are going to stay on because no matter what's popping up here and there, that still is the goal. And so the idea that here we have 10,000 people sleeping on our streets when we only had 2,500 a decade ago, that should be a priority for the city of Sacramento and has not been declared a priority because we have not gone through that process. So that's step one, is we sit down and we say our priorities so that we get more than a status quo budget every year. Right now, it's just last year's budget plus the cost of inflation or whatever, and then we all tinker around the edges to get a line item here and there. But there's not a top level strategy of this is where we're going as a city, this is our vision, and here's what we're going to do over a 2-year period until the next election when half the council
And you can get 5 people, counting yourself, to agree to that?
I absolutely think we should be able to get 5 people to agree to it. And I think that's the beauty of having a collaborative mayor system, is that you sit down and you hash it out and you bring the people together to be able to do it.
So you're saying I'm sorry for interrupting. You said that, so implied we don't need a strong mayor.
We don't need a strong mayor. I think I have not seen us take advantage of our current system of actually having a priority setting conversation and seeing what happens when we don't let the tail wag the dog, but we let the dog wag the tail. The city manager and staff work for the council. If you don't set priorities, then your staff can do whatever they want to. I'm on the executive leadership team at Public Health Advocates, and I know that anytime I have a performance issue with any staff member, the first question I have to ask myself is, did I give clear direction and did I give clear support? And if I can't answer yes to both of those questions, then honestly, the fault lies with me on this performance issue. Now, if the answer is yes to those, then we have to go through, okay, now what's going on with this staff person and why aren't they meeting the goals? But step one starts as a leader with exploring yourself. And if you haven't given clear direction to your staff, you then can't say you're not doing what I want you to do. And so I don't know how you run a city without some priorities and without your staff knowing what they're building a budget to be able to achieve, what each of the departments is trying to work toward. And some of the departments like Youth Parks and Community Enrichment have done a great job at being able to tell you the return on investment and how things are structured, but they've done that on their own. And that should be something that the entire city is able to say, here's our big picture goal of the city we want to live in. Here's everybody's responsibility within it. And these are the goals we're working towards now. And here's the long-term future goals that we're working towards as a city. And we should be able to see that we're chipping away at them like a church's building fund, right? You put it up and then each week you can see it's going up and we're doing something good.
Can't have a church building fund and the hinges on the door are falling off. That would not be a good thing.
Mm-hmm. Absolutely.
So you're painting a picture that is a bit scary, that this isn't going on now.
It's not going on now, and it should be. And that's, I think, what is frustrating to so many people, because I'm pointing out some of the obvious things, which is, why don't we have goals? Why have we not sat down and set some priorities?
There is no, okay, doctor, you're saying there are no goal setting that's going on. It's at the city level right now.
Not from the perspective of the council being able to come together and say, this is what we're doing as a city, and this is what we're working towards. We have not, they literally are just now starting to talk about setting some priorities, but none have been established. And so the staff each week are watching the city council meetings like the rest of us in the community and going, okay, so I guess now we're doing this. right? And we're finding out about it not that long in advance. And so that brings me to the second thing I want to do in those first 100 days after we set some priorities is I also want one of the first pieces of legislation I want to introduce is us changing the way we make decisions as a city. Because right now, we find out on Thursday, Wednesday or Thursday, what's going to be on the agenda on Tuesday. And then we're given 2 minutes to be able to comment on it. And that's not meaningful community participation.
Mhm.
And we actually have a model for what it could look like right at the state level. It's not perfect, but it's a lot better than what we have now, which is that the mayor and all the council members and even the department chairs can submit, hey, here are the pieces of legislation, here are the things that we need to talk about in the next few months. And then those can actually be organized by category and can go to the boards, committees, and commissions that exist within where we've asked volunteers to be our advisors and to be our eyes and ears in the community and tell us how will this work and who will be impacted. We should be going to the Disabilities Commission and saying, how will this impact people with disabilities in our community before we pass a piece of legislation? We should be asking the Youth Commission if something involves young people. Nothing about us without us. We should be consulting the Measure U committee if something's going to come out of that budget. And so it gives an opportunity for the people we've asked for their time and advice to actually meaningfully engage before it goes back to the council for a vote. And then that way, our community members would have ample advance notice about what's being considered, an opportunity to be able to weigh in. And I would love for our community organizations and neighborhood associations, et cetera, to be able to say, I'm in support of this or in opposition. Right now, the only way to know who supports and who opposes is to sit down and watch a council meeting and hear who calls in and says something or not. We should be able to, that should be part of the staff report when it's being voted on, is we know who supports, who's in opposition. We're able to hear from our boards, committees, and commissions of what they thought and what amendments might be helpful so we can make thoughtful decisions. Because we can go far if we actually take advantage of all the expertise in our community and allow for us to make some thoughtful decisions moving forward instead of finding out 5 days in advance and having to decide if we're going to spend 7 hours on a Tuesday night watching and trying to spend 2 minutes to comment on something that feels like it's already been decided.
Okay, so I've been given the high sign now by our wonderful podcast producer, Drew Escobar. But you've set the table for process.
Mm-hmm.
So let's give a current real time issue and give me the 1, 2, 3, 4, 5 steps you would do as mayor, Dr. Cofer,
Mm-hmm.
surrounding homelessness.
Sure. So step one is we absolutely have to have some safe ground. We have to have a place where people can go immediately, where they can shower, where they can charge their phones, where they can be safe, and where they can be free from, law enforcement interference in terms of going off the
safe
jail.
ground located where?
All across the city. So we have some.
Not in my backyard.
I know, and that's the challenge. But this is a crisis, and I believe housing is a human right, and we are in a humanitarian crisis with 10,000 people on the streets and 72% of them being unsheltered. And that didn't happen because just because of like drug use or mental health issues. That happened because we have priced people out of housing. We have to approach this as an economic issue because it is, and then it's exacerbated by some of the other factors that are happening as well. And so we need to be able to, we can't keep passing policies saying, you can't be on my yard and I'm upset because you use the bathroom here and whatever else. We are human beings. We take up space as people and that's not an option. We use the bathroom multiple times a day and that's not an option. So if we don't give people a place to go, it's going to happen. And so we need to start with where can people go, where we can concentrate some additional triaging, right? We have UC Davis medical students who render care to our unhoused neighbors. And during the pandemic, it was so hard for them to be able to do follow-up on COVID tests and things like that because people were constantly being shifted around. And so having a place where people can go and where they can stay and where they can be safe until we can get them somewhere else is step one. We cannot address this crisis while people are moving around.
With step one, just in real time coming here, I saw where city forces were clearing out X Street. That's not safe ground, I'm guessing. So,
and where are they supposed to go?
And that's my rhetorical question.
Yes,
but
and that's the answer we have to have is if we're saying you can't be here, we have to answer the logical question of where can you be? And that should be the question we answer before we move anybody is where can you be? Step two is then where can you be that is long-term housing? And so when Bridget Dean was over the Department of Community Response, she had plans put together to be able to execute long-term leases with some of our hotels and motels, which are kind of doing some of this, in a haphazard way right now in terms of people who are unhoused often save up a couple $100s, especially because 40% are working. And then they'll go and they'll spend a couple of nights at a hotel, or they'll get somebody to pay for it so they can shower and, and have a bed and be able to be there for a little bit. And then they're back out on the street. And so what would happen if we executed a long-term lease with those places so we could actually get people in immediately? They're already set up for housing. They don't need the type of retrofitting that's required to be able to build new shelter, and they're not nearly as costly. And we could actually create communities there where we have families that have kids, so we could do childcare there, where we can have elders, so we can provide some additional support that may be needed for various communities. So they can be both safe, and they're also already distributed through our communities. So to the NIMBYs, it's like, you already have people here. Why not make it so that it becomes part of a community? And then we need to be looking to say, what can we do long term in terms of meeting the gap we have between the amount of affordable housing we have in this community and the number of people? Because the truth is, this crisis is going to continue to expand if we don't do something long term about affordability in this region.
What about wraparound service? We're gonna have to. This is. Doctor, you have to come back.
Thank you.
Period, full stop. You have to come back. But if I could put a button on it, a pin on it, what about wraparound services?
Absolutely. But I can tell you as a public health professional that there's not a single problem, not mental health, not physical health, not substance use, that is made better by having somebody sleeping without the benefit of a roof and a place to stay and some stability. And what we know is that people's mental health and their capacity to be able to address substance abuse issues is increased when they have some of those basic needs met. And so that's why we talk about housing first. It's not because we're ignoring those other things. It's because we're in a much better position to be able to get you substance abuse services if we know where you are and you're in a stable, safe environment. And that's why that has to be part of the goal, is getting you there. Because if we start giving you substance abuse services and then you're back out on the street and fending for your life and don't have a place to go and in and out of jail, you can imagine the disruption that's going to be causing to someone. And so that's really where it comes. But absolutely. And that's where the county as a partner comes in. Because while the city has a $1.5 billion budget, and that's billion with a B, the county has an $8 billion budget. And they also have the primary responsibility for mental health, for substance use, and also to be a partner in housing. We make up a third of their population, which by my estimation says that they owe us somewhere around a third of their budget. And so I would like to see that be placed in some productive ways instead of voting in December to expand the jail when 70% of the people in and out of our jail are there less than 10 days. And so you're going to expand the jail with mental health services that are not going to be effective because people aren't going to be there long enough to actually get the mental health support. Takes time. And we need more ambulatory, meaning you can walk up and walk in to get services. If you're going to do substance use services, they can't be by appointment. If I decide to get sober right now, you need to get me somewhere before I have my next craving and change my mind and I'm off to something else. And so we need to be able to build the things that we know work. I am not minimizing our substance abuse crisis. I am not minimizing. I was just at the Capitol yesterday for the fentanyl awareness, concern, right? Like, I get it. Like, as a public health professional, it's all of these things. And we have to decide, we have to prioritize, where are we going to start? And then how do we bring the other services that we have and expand them so we can meet the need? And right now we have not invested in doing that. And that really is a missing link. And instead of throwing law enforcement, because it's the thing we spend the most money on, and just continuing to double down on that being our solution, we need to think about the things that actually work. Because if law enforcement answered all of our problems, they all have the biggest budgets they've ever seen, and things are worse than they've ever been. So that is not our answer. And I'm a data person. If it were, I would say, sure, let's do it, but it's not.
Well, Dr. Flo Cofer, candidate for mayor, epidemiologist, and passionate about issues.
Yes.
I so appreciate you being in this space. As I said before, I'll say it again. You have to come back, and we have to continue this conversation. There is a ton more questions I have, and you probably have a ton more answers to put out there. But thank you so much for entering into this space.
Thank you really for having me. I really appreciate this. And I'm open to having conversations with anybody who wants to talk about these issues. I know we all care. And that's really the important place that we start is our shared value of caring about our community and wanting to see these issues solved, and being able to, I always say, the goal each day is to address new problems, not to keep repeating, addressing the old ones and to make new mistakes instead of making the same old ones. So I want a city where we want to try new things, and learn from them, and always be in a learning and an innovative space because new things are happening, and we need to be able to meet the moment and learn from the moment and be better tomorrow than we were today.
Thank you, Doctor.
Thank you.